Thank you, Madam Chairwoman. My name is Sonji Wilkes, and I am a mom from Englewood, Colorado. I would like to thank the Chairwoman, Congressman Burgess, and members of the subcommittee for the opportunity to discuss my family's experience with surprise billing and ask you to end this practice. When my husband and I became first-time parents as healthy 20-somethings, neither of us had much experience with insurance, but we had a valuable lesson when we received a bill double what we expected. Seems the insurance company counted me and my newborn daughter as two separate patients. Though surprised, we paid the claim and moved on. 2 years later, we decided to grow our family. A little wiser, we made sure to ask specifically if we would incur 2 co-pays. We double-checked that our OBGYN and the facility that we were to deliver at were in network. Per the documentation from our insurance provider, we were covered. My son Thomas was born full term. By all appearances, he was a healthy boy. Several hours after Thomas was circumcised, our pediatrician called to say that he was concerned that the circumcision site continued to bleed. The next day, he called us in tears to say that Thomas had severe hemophilia A, a genetic disorder that prevents his blood from clotting. Our doctor told us that hemophilia was a Thomas was taken to the neonatal intensive care unit so that he could be closely observed. Within the hour, a specialist from the local hemophilia treatment center was standing in our hospital room, and after asking if we had good insurance, spent the next few hours explaining hemophilia to us. She brought a dose of clotting factor for Thomas to stop the bleeding, as the hospital did not stock that medication. In the NICU, the hematologist started an IV line in my son's scalp while the NICU staff intently watched. They had never treated hemophilia. While the hematologist was not part of the hospital or the NICU staff, we never saw a bill for the medication she administered or for her time or services. Thomas remained in the NICU overnight for observation. Neither my husband or I left our son's side, and other than monitoring his vitals, there was no direct care given to Thomas. As a nearly 10-pound baby, he was a bit out of place in the NICU. We were discharged within the normal postpartum period and went home to come to grips with an unexpected chronic disorder diagnosis for our baby boy. A few weeks later, we received another shock, a $50,000 bill for Thomas's stay in the NICU. We were dumbfounded. We had been at an in-network facility. How could we possibly be responsible for that amount? My husband and I felt we should not be held responsible. We did some research and found out that the hospital had subcontracted the NICU out to a third-party provider. This third-party provider was the one demanding payment. We had made a good faith effort to stay in network. We refused to pay the bill and subsequently were sent to collections. Our credit was ruined. Sometime later, our minivan lease was expiring. As we headed to the dealership, we knew we wouldn't qualify for a new lease. I had to have a car. Thomas was being seen at the hemophilia treatment center multiple times a week. At the finance manager's desk, my husband and I explained the surprise bill. As I emptied the Kleenex box sitting on his desk, he started tapping on his computer, wiped a tear of his eye, and said, "We'll make something happen for you. It might be at a crazy high interest rate, and you'll have to keep the car until the day it dies, but I understand your situation because something similar happened to my family." I'm still driving that minivan. When you were told your baby's body lacks the ability to stop bleeding and that he needs immediate specialized treatment, your first reaction isn't, "Gee, I wonder if that's in network." Your first reaction is, "Do whatever it takes to save my baby." Why would I check if the NICU, just 50 steps away from the room that I gave birth in, was in network? I think any reasonable person would assume it to be because it seems reckless and cruel that it would not be. No family should face financial ruin because they are duped into thinking that they are at an in-network facility or because the in-network provider contracts out services like radiology, lab services, imaging, or more without the patient's knowledge. While transparency and disclosure of any out-of-network sub-provider is critical, it's not enough. Navigating health insurance is extremely difficult, and especially so in crisis or for the inexperienced. According to a recent Kaiser Family Foundation poll, 4 out of 10 respondents said they had received an unexpected bill from a hospital, lab, or doctor in the past year. But surprise billing is not a new issue. My personal story is from 2003. Patients need you to pass protections to stop these harmful practices. I wish this wasn't mine or anyone else's stories to share. Please protect Americans from excessive bills and medical debt by ending this surprise billing. My families and millions of others thank you in advance.